Non-technical tech roles that don't even seem real. This one is called Clinical Product Manager at a company called Semble. Semble is a company which provides software to different clinics to allow them to do private prescribing, book appointments, that kind of thing. You'll be responsible for developing new clinical products. So, for example, building new features, talking to different product teams, engineers. One of the key things about this role is being able to build good relationships with other team members. So a key point of clinical product isn't just about developing new product, but it's about how do you convey what needs to be built to engineering teams, the operational team, business teams, and maintaining that relationship across so that you can communicate your requirements across to all those teams in an appropriate time frame. Another key area of this role is the ability to be a clinical safety officer. A clinical safety officer in the UK is somebody who is a registered clinician, so that could be anybody that is registered with a clinical board, example, a pharmacist, a nurse, a physiotherapist. Clinical safety training revolves around governance and risk management. So identifying if there is any clinical risk that is being baked into the product and how is that being mitigated. If you're unsure about clinical safety, as a clinical safety officer myself, I can help you cultivate and develop that part. If you'd like to know more, comment linked. Role in question. The eligibility criteria is quite clear. First of all, to be a clinical safety officer. Secondly, to be a clinician. Thirdly, to be able to build those relationships and cultivate those cross-functional conversations. And by that, I mean basically having a chat to everyone around you, being nice, being kind, and all speaking the same language. A lot of this is not being afraid to ask why, because when you go into a new environment, you will meet people from different sectors who will use certain, abbreviations or things like that. But having the confidence to ask, what is that? Why do we do this? Is a really important aspect of the role. So how do you apply? This role is a semi-entry level into clinical products. So you will report to the senior clinical product lead. I would highly recommend reviewing the job application, because even if it's not something that you can do now, it's definitely a springboard to identify what are the key criteria that, you might need to gain experience on over the years to then apply for this role in the future. So comment link, and I'll send you all the bits on clinical safety and, most importantly, the link to this job role.